Good day, everyone. Today we will be discussing on body mechanics. I am Glenda Rivera here, presenting to you the concepts and principles related to body mechanics. First, let me discuss to you the learning outcomes. We have to describe the principles of body mechanics, identify variables that influence body alignment and mobility, differentiate isotonic, isometric, and isokinetic exercise, apply body mechanics in the real setting, and appreciate the principles and usage of body mechanics as you applied it in the real scenario. First, let's define body mechanics. It is an efficient, coordinated, and safe use of the body to produce motion and maintain balance during activity. The use of proper body position to provide protection from the stress of movement and activity, specifically in regard to structure, function, and position of the body. Also, body mechanics involves patient handling, tasks that are the primary cause of musculoskeletal disorders among nurses. In the US, it is accounted that 52% reported back injuries and 12% leave the profession annually because of the problem on body mechanics. What are the benefits of body mechanics? First, it promotes body musculoskeletal functioning. It reduces the energy required to move and maintain balance and decrease the risk of injury. It therefore prevents strain, injury, and fatigue. There are variables that can lead to back injuries or back pain for healthcare workers. These include uncoordinated lifts, manual lifting and transferring of patient, lifting when fatigued, lifting after recent recovery from a back injury. There are repetitive movements and standing for a long period of time, then transferring and repositioning patient. There are three basic elements of body mechanics. It involves body alignment, which includes posture. Then we have balance, that describes stability. And then we have coordinated body movements. For body alignment, it describes the geometric arrangement of body parts in relation to each other, aka good posture. Proper body alignment involves alignment of body parts that permits optimal musculoskeletal balance and operation, thus promotes healthy physiologic function. In this slide, you could differentiate what is a good from a bad or poor posture. We also have another example here in which how you need to move your body from one position to another. You can also differentiate the different types of movement of your body part according to the structure of your thoracic and then how you do your forward movement considering the head part. Therefore, posture reflects the mood, self-esteem, and personality of an individual. Balance. When you talk about balance, it is a body in correct alignment. An object is balanced when its center of gravity is close to its base of support. The line of gravity goes through the base of support, and the object has a wide base of support. Therefore, balance also involves the center of gravity in which the average location of the weight of an object. We can completely describe the motion of any object through space in terms of the translation of the center of gravity of the object from one place to another, and the rotation of the object about its center of gravity if it's free to rotate. Consider also your base of support. These are also considered as an unstable movement, especially for the elderly. Coordinated body movement involves the ability of muscles to work together for the purposeful movement. Take advantage of the body's natural levers and fulcrums. It facilitates the actions of lifting, carrying, pushing, pulling, and moving objects. Orthopedics also refers to correction or prevention of disorders of body structures used in locomotion. It involves tonus, no, a state of slight contraction. It also considers contractures, a permanent contraction of a muscle. There are factors that affect movement and alignment. Consider developmental consideration from infant to elderly. You also have physical health, mental health, lifestyle consideration, attitude and values. When person is fatigued and stressed, it affects also movement and body alignment and several external factors. Exercise is an active exertion of muscles involving the contraction and relaxation of muscle groups. It involves the following major types: muscle contraction and body movement. These are examples of your types of exercise. You have isotonic, isometric exercise that involves muscle contraction. The isotonic exercise involves enhancing circulatory and respiratory functioning. It promotes osteoblastic activity, increased muscle mass, tone, and strength. Isokinetic exercise also is the sustained exercise in which it stimulates and strengthens specific parts of the body but have effect on overall fitness. It involves high intensity, includes short duration, however, it allows low endurance or stamina, then examines sprinting and weightlifting. For the body movement, we also consider aerobic exercise, stretching exercise, strength and endurance exercise that allows movement and for the activities of daily living. Here, the aerobic exercise involves rhythmic body movement that increases blood flow, heart rate, and metabolic demands for oxygen over time. Stretching exercise also involves movement that allow muscles and joints to be stretched gently through their full range of motion, thus increasing flexibility. Strength and endurance also are the components of a variety of muscle building programs. It, in nursing, we consider the nursing process. Also in the body mechanics, the following are involved. Assessment. In the assessment aspect, we can use both interview and physical assessment skills. These include nursing history, physical assessment that technically defines the general ease of movement and gait, alignment, joint structure and function, muscle mass, tone, strength, and endurance. For diagnosing, it involves activity intolerance, impaired physical mobility, there is risk for injury, impaired transferability related to generalized weakness, bathing, feeding, dressing, toileting, self-care deficit related to physical weakness and altered mobility. The nursing process also involves outcome identification. From here, in planning portion, you have to identify if the patient will follow a program of regular physical exercise that improves cardiovascular function, endurance, flexibility, and strength. By the next visit, for example, the patient will be able to identify 4 personal benefits of regular exercise. The patient will be able also to describe an exercise program in which he or she is willing to follow. Then the patient will also be able to identify his or her target heart range. Also, it can be stated as demonstrate correct body alignment whenever observed and adhere to an every 2-hour positioning schedule, then demonstrate full range of joint motion, demonstrate adequate muscle mass, tone, and strength to perform functional activities of daily living. For another outcome, the patient is expected to be free from signs of skin breakdown, the change from a lying to a standing position safely without injury, then show signs of adequate venous return and be free from contractures, thus maintaining effective airway clearance. For the implementation aspect, you have to do application of body mechanics to prevent injury, ensure safe patient handling movement, and position patients in bed. There are 4 principles of body mechanics. Keep a low center of gravity by flexing your hips and knees instead of bending at your waist. This position distributes weight evenly between the upper and lower body and helps maintain balance. When providing care to a patient in bed, position the bed at the correct height. Consider the hip level when moving the patient. These are the application of body mechanics to prevent injury. This is to, this is to develop a habit of erect posture. Consider again how to develop a good or appreciate good from bad posture. So check also the proper manner on sitting. For body mechanics, you only need the following yourself. Consider also implementation. Follow the direction below in pushing, pulling, stooping, lifting, and carrying correctly. When you have to push and pull correctly, stand close to the object with one foot slightly ahead of the other, as in a walking position. Tighten your leg muscle and set your pelvis by simultaneously contracting your abdominal and gluteal muscles. In pushing, place your hands on a stable part of the object and flex your elbows. Lean into the object by shifting your weight from your back leg to your front leg and apply a smooth continuous pressure. To pull, grasp the object and flex your elbows. Lean away from the object by shifting your weight from your front leg to your back leg. Pull smoothly, avoiding sudden, jerky movements. After you have started to move the object, keep it in motion because stopping and starting using more energy. When stooping, follow the correct position. Stand with your feet shoulder width apart and with one foot slightly ahead of the other to widen the base of support. Lower yourself by flexing your knees, placing more weight on your front foot, then on your back foot. Alternately, rest one knee on the floor and bend the other knee at a right angle in front of you so that you are in a half kneeling position. Keep your upper body straight by not bending at the waist. To stand up again, straighten your hips and knees while keeping your upper back straight. Assume the stooping position when lifting and carrying correctly. Directly in front of the object to minimize back flexion and to avoid spinal rotation when lifting. Grasp the object and tighten your abdominal muscle. You need also to stand up, straightening your knees using your leg and hip muscle. Always keep your back straight to maintain a fixed center of gravity. Keep your weight of the object as close to your body as possible. Then carry the object close to your body at waist height near the body's center of gravity to avoid straining your back muscle. There are some special considerations that we need to follow. When lifting or moving a patient, use assistive or mechanical devices. If available, and obtain assistance from co-workers to prevent the risk of musculoskeletal injury. Mechanical and other assistive devices have been shown to significantly decrease incidences of low back injury among nursing personnel. Wear shoes with low heels, flexible, non-slip soles, and closed backs to promote correctly body alignment, facilitate proper body mechanics, and prevent accidents. Pull rather than push an object when possible because the elbow flexors are stronger than the extensors. Pulling an object also allows the use of hip and leg muscles and avoids the use of lower back muscle. There are common devices to promote correct alignment. Consider pillows, mattresses, adjustable beds, trapeze bar, and additional equipment considering the foot drop. A trapeze device makes it possible for the patient to lift part of the body from the bed, facilitating turning and moving up in bed. This is also your Fowler's position, in which you use the pillows to support your body or your back. For this, you can see how the knees may be elevated considering Fowler's position from an angle of 45 to 60 degrees. For the semi-Fowlers, you consider 30 degrees, in which you could also see the degree of elevation from the head part with your knees slightly elevated. Then you could also have high Fowler's position with the angle of your head at more than 80 degrees, or more likely some books would tell you 90 degrees. Based from this picture, you could also see a supine position and a prone position.